Good morning and welcome to Health Talk here on AM 1270 and 96.5 FM KXBX. I'm Paul Thomas, and in the studio with us every Wednesday at 10 a.m. is Bill Kearney of Northlake Medical Pharmacies. And Bill, we just had a pretty busy weekend, and it's going to be that way probably for the next couple months as summer is really kicking into gear here. The weather's been a little bit cooler than normal, but yeah, we're right in the thick of it.
Oh boy, I'll tell you, Saturday was we had the wooden boat, Wooden Glory. We had the car show. We had the boat races, and we had the chicken queue and the Upper Lake Western Days all going on at the same time.
Wow.
And the irony of all that is if we'd had as many people show up for the boat races as what they predicted, there would be no place for them to stay.
Yeah.
I mean, we don't have, if you had 5,000 people here, there would be no place for them to stay. We have to do something about getting more accommodations for tourists, and if this is our main industry, which it appears to be at this time before marijuana takes over, this is something that we need to work at. I worked the chicken queue on Saturday, barbecuing chicken, and we were out of chicken by 4:30 or 5, and we had more than we usually have. So that was very well attended. The boat races were moderately attended, and the Wooden Glory, I think they had about 100 boats. So a lot going on, and that's just the beginning. The concerts in the park start in a week, right?
Yeah, a week from Friday.
And that starts on Friday, and then everything with graduations and everything going on. Part of the graduations have already been completed, and so we're getting into summer, and I'm going to start about talking about the sun, which is I saw evidence of people that had been in the sun too long, and about how to take care of your body. And I want to start out by saying we're under new management, not new ownership, new management. We at Bruno's, Northlake Medical Pharmacy number 2. So Cindy Messick and I are managing the stores now, and the store at Bruno's, and I still own both stores. But Steve has left our employment, and we're trying to turn some new leaves over and have a good beginning to our 38th year or 39th year. I can't remember. It's when you get to be 75, you don't know if it's been 1 or 40. But
it's okay to do that with the business. But you start doing that with your marriage, then
yeah,
you have problems.
Yeah.
Right?
Well, luckily I've only had one, and that's 44. I don't forget that part. So. Anyway, while I was working the chicken queue, I noticed a lot of people with white skins and things going on. Then I went over and worked the boat show the next day, the boat races, and I was talking to one individual who had been in the military many years ago, and he was in the Marines, and he got a severe sunburn. And I said, well, I was in, Vietnam, Korea, both winter and summer, and I never did see any sun protection things out at that time. Of course, that was 50 years ago. And he said, well, when I was there, what they used was baby oil and iodine. When I was in high school, baby oil and iodine were what the teenage girls used to tan themselves quicker. Well, the military's feeling at that time was it would give you a base tan, so you wouldn't burn as bad.
Nice.
So I saw an article on, should I go to a tanning salon before going on vacation to help prevent sunburn, and there's really little evidence to support that idea that a base tan protects you against sunburn. Maybe a few sessions of indoor tanning will not prevent you from burning in the sun, but the base tan is no substitute for sun protection. One gal who I know very well, her shoulders were all burnt, and I says, you look like you got a pretty good sunburn. Well, I've got to get that burn on first, and then I'll start on my shoulders, and then I'll work on the rest of my body. And 2 or 3 people there said they were doing the same thing. So in order to not keep belaboring this point, but because how important it is, because melanoma skin melanoma is one of the most increased types of cancer right now. The best thing is to avoid sun exposure between 10 and 4 o'clock. That's when the rays are the strongest, and cover up with lightly woven clothing that protects your arms and legs. And you can actually buy clothing now that has an SPF factor, and a broad-brimmed hat and sunglasses with UV protection, and then apply a Spectrum sunscreen with at least a 15. And if you have the white skin that I saw many people have over the weekend, you need at least a 30, and you need to put that on every 2 hours or more often if you're in the water. So some people may have medical conditions that require a few short exposures to UV light before summer or sunny vacation to prevent flare-ups. So you need to talk to your doctor about what you should have. You know, if you do get sunburn, and most people won't listen to this because, and you've heard me talk about all the time, if you're going to go out lay around the pool or be out in the sun or be watching a ball game or watching the boat races or at a barbecue, put that sunscreen on 15 to 30 minutes before you go outside. That sunscreen is something that will, it requires a chemical reaction in order to protect your skin. So if you go out there at 11 o'clock typically is when you see all the boats going out of the marina, and I see people putting on the sunscreen on themselves and on their kids as they're going out of the marina. That is not soon enough to help you from getting, especially at that time of day. So because the sun rays are the strongest there, that's when you're going to get burnt. And you tell yourself, well, I put it on, it says it lasts all day. It lasts no more than every 2 hours, and if you jump right in the lake or right in the swimming pool, you need to reapply it. And we never used to tell you that, but we're having a lot of burn situations from people that are trying to do the right thing, yet it's not working. So we want to make sure that you have every opportunity to protect yourself. If you do get sunburned, stay out of the sun, protect yourself from the sunlight as much as you can. Avoid applying cane products such as benzocaine because they may irritate the skin or cause an allergic reaction. And unfortunately, that's what's in most all of the soothing things, and I kind of disagree on this. The only thing that I would suggest if you have young kids under the age of 2, never use that benzocaine because they could have an allergic reaction. I just saw an article on the internet yesterday where a little baby had gone out and they used banana boat, and they make several different ones, so I can't tell you which one it was. But the child developed an allergy to one of the chemical ingredients in the sunscreen and became extremely blistered and burned chemically, not from the sun, but from the reaction. So, like so many things in healthcare today, we're telling you that this is something you should use and when to use it and how much to use it, and then you see a child. And giving a child a sunscreen is pretty important because they don't have a cooling system. They don't perspire the way we perspire when they're very, very young, when they're infants. So keeping them out of the sun is pretty important. It is important, actually, to keep them more covered up than anything. There's all kinds of home remedies that you can use to make you feel better after you've been sunburned. You can take a pain reliever such as a non-steroidal anti-inflammatory, Motrin or Advil or Naproxen, Aleve. If you take it soon after the sun exposure, sometimes it will help the swelling before it occurs. Cool the skin with a compress, such as a towel dampened with cool tap water. Not to prevent sunburn so much, but we use, when we're barbecuing, we get a cloth that's insulated, and you dip it in ice water and put it around your neck, and that will keep your body temperature down. Apply a moisturizer, such aloe vera lotion or gel might be soothing. And if you get these blisters, which a lot of people are looking for, they want to get the blisters to get the burn over with. Don't break small blisters, no bigger than your little fingernail. If it breaks, you've got to clean the area with mild soap and water, put an antibiotic ointment on it, and cover it with a nonstick gauze bandage. And then when you start peeling, that's your body's way of getting rid of the top layer of damaged skin. While your skin is peeling, continue to moisturize your skin. Also, using an insect repellent, apply the sunscreen first, and don't combine an insect repellent with the sunscreen. So don't buy a sunscreen that has an insect repellent in it. You can use the sunscreen on toddlers and babies 6 months or older. The best products for those are ones that contain titanium oxide or zinc oxide. For babies under 6 months, using other forms of sun protections, as we talked about, such as a shade or clothing. One thing that many of you don't think about is what medications am I taking? Are they causing a photosensitivity? And that's exactly what was happening with this infant. The sun actually caused a photosensitivity reaction with some of the chemicals. So common drugs that make you more sensitive to sunlight include antihistamines, ibuprofen, like non-steroidal anti-inflammatory, certain antibiotics, certainly some of the birth control medications, antidepressants, antipsychotics, some cholesterol-lowering drugs, people that are taking fluid pills such as hydrochlorothiazide or triametrine with HCTZ will cause you to have photosensitivity. Now, that doesn't happen with everybody, but it certainly can happen to many people, and something that you need to be aware of. When I was going through my paperwork this morning, I noticed that there was an article about people trying to lower their blood pressure with, or their diabetes with medication to get their blood level down to a susceptible level for the diabetes. And what happens is people have been doing that for years and years, and all of a sudden they never looked at what is going to, whether it's going to do anything else other than lower your blood pressure or lower your blood glucose level. So when they were doing it, all of a sudden, for some of the newer drugs, they're looking to see if they had a substantial benefit, cardiovascular-wise also, as to lowering your blood sugar. And lo and behold, they couldn't find that this improved your cardiovascular risk at all by lowering your blood glucose level. So now they're testing drugs to find out whether or not that they are able to lower your blood glucose level and still have a positive sign as far as whether or not you can have a cardiovascular benefit from it. I'm kind of tumbling around here because I had some physical evidence of how effective that was, and now of course I can't find it, and here it is. They want to know how low to push blood sugar and how to do it, and people are always trying to get that one figure down to below that A1C level, down to below 7. And the starting point, of course, like all of our information on lowering blood glucose and many, many kinds of disease states is to diet and exercise. And even the people that attempt to do the diet and exercise, many of them that's not sufficient to do it. So the doctors and patients are faced with two questions. How low should your A1C level go, and what drug should be used to lower it? And, you know, we track blood sugar by testing for levels of A1C, which reveals average levels over the previous 3 months. And for those of you who aren't diabetic and don't remember, an A1C level is not something that you get off your blood glucose meter. It's something that you get when you go in to see a physician. And it's difficult for you to know where it is, but what happens is your red blood cells remember everything for the last 3 months. So if you're going in to see your doctor and they're going to take a blood glucose meter and test your blood sugar level, which is going to come out somewhere between, you know, hopefully 120 and 60, they're going to find out that you probably cheated the day before and didn't eat any sugar because you knew you were going to have a doctor's appointment. You go in to have an A1C test and you can't cheat because it memorizes how much blood glucose, how much sugar was in those red blood cells for the last 3 months. So it's a good predictor of risk, but the question is who benefits from a real intensive blood sugar lowering and which drugs are best for who. As we've talked many, many times, it starts being very confusing about what the healthcare industry tells you. At what level is actually appropriate only for young people that are just newly diagnosed that have no other medical problems, older people with chronic conditions like arterial sclerosis, which is hardening of the arteries, shouldn't aim for such a low level because they can't find any obvious benefit to them, no real reduction in the rate of complications like kidney or nerve or eye disease. And even what's more troubling is high levels of A1C are linked to an increased risk of heart disease. So what's not clear is whether a drug that reduces that A1C level will also improve cardiovascular risk. And we're talking about a chance of a heart attack or a stroke. Several years ago, or not that long ago, recently, the Food and Drug Administration, making some of the newer diabetic drugs, started testing them to be certain they were not actually raising the chances of heart disease when they lowered the A1C level. And they were pretty surprised at the results. At identical A1C levels, some drugs lowered the risk. Some actually increased the risk of heart disease. Older and much cheaper medications like metformin, which has been around for a long time, and diabeta, and some of those have not been subjected to those tests because they weren't relevant at the time. They've been around for a long time and they're well established, but whether they actually prevent heart problems is unknown. And to give you just a little background here, now all of a sudden we're finding out that PPIs, proton pump inhibitors, can cause people to have a chance of more cardiac events. And it's done to lower your acid, your gastric acidity in your stomach. We're finding out some of the statins can cause more side effects. Instead of decrease your chance of a cardiovascular event, they could increase your chance of a cardiovascular event. So here we are with drugs. We brought out Premarin for people post-menopause to keep their bone density down. We found out that the more Premarin you took, the more we increased your risk of having a cardiac event. So now, you know, the use of Premarin or conjugated estrogens right now in bone density is quite small compared to what it used to be. So, you know, none of that stopped doctors from asking people to lower their blood sugar at all costs, but many of their patients, particularly the older ones, which have a lot more disease states, often take a lot of other medications. And the more drugs they take to get an A1C level of 7, the greater risk of ensuing complications, including, if you've seen these new drugs like Repatha, skyrocketing costs. And then they run the risk that blood sugar levels will dip too low. So there was a patient on this study that learned that he had diabetes 30 years ago, and he spent years chasing an A1C of 7, requested by doctors who focused single-handedly on that number. They were always upping the dosage of drugs, wanting to get to 7. One doctor was very adamant and very demanding. He told him if he didn't do what he said, he would no longer be here much longer. The patient felt the treatment was just to pound drugs and hope they worked, but he rarely hit that target, and the drug caused a lot of uncomfortable side effects while he was taking them. His blood sugar dipped up and down after going so low that he experienced sweating, confusion, and dizziness. His doctors realized that there was definitely a connection between lowering the A1C and heart disease. If they'd have known that, they might have been less insistent. I just had a patient that was not a diabetic, and he was on a trip, and he's a paraplegic, and he was on a trip, and he fell asleep on the airplane going to another location. They got him up and found out his blood sugar was way too low. They continued to do things to elevate the blood sugar, and they were not successful. They could bring the blood sugar up where it wasn't causing him to go into a coma or pass out, but they couldn't maintain that level. They were finally successful in doing that, but no history of diabetes at all, and still couldn't maintain a higher blood glucose level. So it's okay to take one drug we know, which is insulin, which a lot of people will prefer that over to a pile of diabetic drugs, and I mean a pile. There are, I think, 7 different ways to lower blood glucose levels now. And it used to be the only thing that we had was insulin, and insulin was very effective at doing that, but it wasn't convenient because a lot of people didn't want to take a shot, which is one that actually is subcutaneous, and they're getting pins now, insulin pins, that already have the amount of insulin you're supposed to inject in it, and they become quite expensive, over $1,000 a month for some of them. And there's, and we know that this works, but whether or not it is the only way to lower your A1C level without having a medication that works differently is rather tenuous. So do we spend all that money? Is it necessary to spend? You know, insulin isn't a new product. You know, insulin is something that has been around for a long time. The price shouldn't be so costly that you couldn't afford to get it, but it's becoming that costly now, and we need to do something to bring those prices down. You've heard me talk all the time about trying to get involved with pharmacy benefit managers and eliminate the DIR fees, which are causing the cost of your medication to be increased. We're doing everything we can to be effective at doing that, but we're battling Big Pharma, which is the drug manufacturers and the pharmacy benefit managers and the insurance companies, to lower your copays. And hopefully independent pharmacy can continue to survive. Off of this for just a minute, we are concentrating the month of June on Alzheimer's disease. We are partnering Good Neighbor Pharmacy, which is our group, that PVA that we have, that we do all of our contracts with through AmerisourceBergen, is getting involved with the Alzheimer's Association to try to be significant donors to people being educated about what Alzheimer's really is. And some of the symptoms are, and if I read through these, you're going to think you have it for sure. Memory loss that disrupts daily life, one of the most common signs. Others include targeting dates or events. If your calendar socially is like mine, I never know where I'm supposed to be unless I look at the calendar, because every day it's someplace else, or evening it's someplace else, or weekend it's 2 or 3 different places. Challenges in planning or solving problems, finding it difficult to develop or follow a plan with numbers, may have trouble following a recipe or something like that. I make myself notes on things to get accomplished during the day because you get distracted too much. Confusion with time or place. You can lose track of dates, seasons, and passages of time. That isn't anything very drastic in most cases. You just, all of a sudden your life gets so busy, and you wonder what, is, for a second, is this spring or summer or winter, or what, what's going on here, because you don't have time to, then you look out and you see the green grass, and of course so if you have trouble understanding visual images, some people may have difficulty reading, judging distance, and probably that's when you need to stop driving because of visual problems and not having any depth intensity. New problems with words and speaking or writing, words that you've always been able to master before, and now you may have trouble joining a conversation. You may stop in the middle of a conversation and have no idea on how to continue, or if you're repeating yourself. Again, a lot of these things are, as the aging process goes, it's when they get to the advanced stage. Sometimes you have trouble finding the right word, but is it remembering the word that you were just using? Misplacing things and losing the ability to retrace steps. I lose things all the time, but I know where to go to find them. They may put things in unusual places. They may lose things and not be able to go back over their steps and find them because they don't remember where they put them. I remember when my mother died at 94 years old, she would ask me probably, and she lived in Iowa, and I would go to see her twice a year, and she would say, "Where are we?" And I'd say, "Mother, we're right here. We're at Karen's house," or whatever, and when are we going to have breakfast, or when are we going to eat? We just had breakfast. We just ate. Those are typical ways that can happen. Misplacing things from time to time and retracing steps to find them isn't necessarily Alzheimer's. It's when you can't remember where to go back to. And then people with Alzheimer's experience changes in judgment or decision making. They may have poor management skills when it comes to handling money. That's why some of the elderly are a perfect match for these con artists. I just walked into work yesterday and I had a call. It was a 707 number, and I assumed it was from Lake County or Mendocino County or Sonoma. I thought it was somebody local, and I answered the phone, and there was this guy telling me that I had been selected by the IRS because I was delinquent in paying taxes. I would be under arrest if they ever found me, and that I should get in touch with them tomorrow and let them know what I decided to do about it. And I know what they were searching for. They were searching for a Medicare number and some sort of a number for Social Security. I called them right back. I can't repeat on the air what I called them, but I told them if I ever heard from them again, they'd be in prison the rest of their lives. So, but that's the kind of things that people, look up people to have Alzheimer's or just aged people that may not pay attention. And then withdrawal from social activities. If you don't like to be around anybody, the mood and the personalities of people with Alzheimer's can change. They become confused. I'll never forget one of our friends that was in Rotary stopped by the pharmacy one day and who lived out by Canocti where I did, and asked me if I knew how to get home. And I called his wife, and she came in and guided him home. But that was beginning of dementia and Alzheimer's. We're going to take a break. When we come back, we're going to talk about a little bit about silent heart attacks, and although I'm not looking forward to it, 11 key findings from one of the most comprehensive reports on the health effects of marijuana.
Have you recently been discharged from the hospital or special care facility and need help in getting around your house? Hi, my name is Bill Kearney, owner of Northlake Medical Pharmacies in Lakeport. My wife Dana and I own Northlake Medical Pharmacies, and in the last 7 years, we've been offering a new service in Lake County. Both of our pharmacies now sell and rent hospital and medical supplies. So if you need a walker, rollator, wheelchair, transport chair, we will rent them to you or sell them to you if you prefer. We also have lift chairs, hand, wrist, knee, leg, and back braces for your comfort if you need them. And if you're looking for a pharmacy that has great service, a $4.99 a month generic prescription plan, free delivery service to Lakeport, Upper Lake, Nice, Lucerne, and now Kelseyville, as well as rental and sales of medical supplies, then you need to come to Northlake Medical Pharmacies on Hill Road across from Sutter Lakeside Hospital and in front of the Bruno Shop Smart on Lakeport Boulevard.
This is the Caltrans Road Information Bulletin for Lake and Mendocino County State Highways for the week beginning Friday, June 2nd. In Lake County, on Route 20 near Mitchell Road, expect 5-minute delays, and near Harvey Boulevard, a company might cause 5-minute delays beginning the 8th. On Route 29, in multiple locations, expect 15-minute delays weekdays and weeknights. In Mendocino County, on Route 1 near Iverson Road and near Wages Creek, expect 5-minute delays weekdays. On Route 20 near Road A, expect 5-minute delays weekdays. On Highway 101 near Leggett, expect 20-minute delays, and also a detour onto 271 could add some time to your route. On Route 128 west of Yorkville, expect 5-minute delays weekdays. On Route 162 from Rodeo Creek to Pukini Fairbanks, expect a few 10-minute delays. On 175 east of Buckman Drive, expect 30-minute delays. Finally, on Route 253 from Boonville to Ukiah, expect 10-minute delays. That wraps up the bulletin. You can always check 1-800-GAS Road and Quick Map for updates on your route, and like us on Facebook for more updates. That's Caltrans, District 1.
Join DripWorks for an exciting day at the second annual Drip Fest in Willits, California. Enjoy fun games and activities for the kids, live music, merchant booths, food vendors, and great deals on drip irrigation products. DripWorks will be hosting a drip irrigation class from 11 a.m. to 12 p.m. on Drip Basics from the famous local irrigation garden expert Chris White, with live music by Marcos Mine. That's Drip Fest, July 15th at 11 a.m. For more info, call 459-6323.
Raising your family, tending to your animals, growing your own produce, preparing for the seasons, living the country life. Hi, I'm Jody Henke, host of Living the Country Life. Catch me every Monday through Friday at 9:35 a.m. and 4:35 p.m. for ideas and inspiration for your place in the country. That's Living the Country Life here on AM 1270 and 96.5 FM KXBX.
We bring the community closer together, supporting business in every way. We're helping make your dreams come true, working hard for you.
The Lake County Chamber of Commerce would like to recognize the Member of the Month, Management Connections. Management Connections is a full-service staffing agency providing temporary, temp-to-hire, and direct-hire placements and matching local employers with qualified job seekers. While the Lakeport office of Management Connections has only been open for 2 years, the company's Cloverdale location has been open since 1991. Management Connections is located at 290 North Main Street in Lakeport and can be reached at pam@norcaljobs.com or 263-4-JOB.
Lake County Chamber of Commerce, we're steady and strong, help us shape the future.
Alrighty, we're back.
Well, Paul, as you know, marijuana is a fact of life in California, not only medical marijuana, but recreational marijuana. And so it's still a Schedule I drug. It's still unable to be dispensed by pharmacists because it's illegal, but it can be dispensed by people right off the street without any kind of medical knowledge about other than how high you get or what percentage it is. I have campaigned against illegal marijuana for most of the time I've lived in Lake County. I've lost that. My life has been threatened on numerous occasions by the cartel, and but it's a fact of life. And although I think it should be dispensed through pharmacies, that's not the way the state of California has decided to go, as if other states have. But there's still a lot we don't know about cannabis. There was a massive report released yesterday by the National Academy of Sciences and Engineering and Medicine that gives one of the most comprehensive looks and certainly the most up-to-date. And exactly what we know about the science of cannabis. So the committee behind the report, representing top universities around the country, considered, and you know I'm great about big studies, 10,000 studies for its analysis, which it was able to draw a bunch of conclusions. In large part, it reveals how much we still have to learn, but it still shows you how much we know about certain effects. Having good research is essential, of course, so we really know what we're dealing with. The people that have smoked marijuana forever could probably care less. There are surprising findings on cancer, mental health, and more. And before we really get into this thing, there are two things to keep in mind. The language in the report is designed to say exactly how much we know and don't know about a certain effect. Terms like conclusive evidence means we have enough data to make a firm conclusion. Limited evidence means there's still significant uncertainty. And if there are good supporting studies, an idea and different degrees of certainty fall between those levels. So for many things, there's still insufficient data to really say anything positive or negative. Remember, most studies that are done on chemicals and medications that are dispensed in the pharmacy are done by drug companies, and they spend millions and millions of dollars on research. The second context is important because many of these findings are meant as just summing up the facts, not endorsements or condemnations. The report found evidence that driving while high increased the risk of an accident, but it also notes that certain studies have found lower crash rates after the introduction of medical cannabis in an area. I had a friend in San Jose when I was working for Walgreens that was a regional manager for one of the tech industries, and he smoked marijuana every day of his life. And he would go up Mount Hamilton in his Porsche after he'd smoked a joint and run that mountain better than he ever could if he wasn't smoking. Very difficult to see, but I actually observed it. But with that in mind, here are some of the most striking reports from the report. There was conclusive or substantial evidence that this can be a real effective treatment for chronic pain. I agree with that. According to the report, which is by far the most common reason people request medical marijuana, however, I want you to know that medical marijuana is not a huge industry in the consumption of marijuana. Most of it is recreational. With similar certainty, they found that marijuana can treat muscle spasms related to muscular sclerosis, help prevent or treat nausea and vomiting associated with chemotherapy, found evidence that suggested marijuana increased the risk of a driving crash, and they also found evidence that in states with legal access to marijuana, children were more likely to accidentally consume cannabis. We looked at all those things and found out the risks in many of those things were small. The overall accidental ingestion among children went from 1.2 per 100,000 2 years before legalization to 2.3 per 100,000 2 years after. There's still a far higher chance parents call poison control because of kids eating crayons or diaper cream or something like that. They found moderate evidence, a pretty decent level of certainty that cannabis was not connected to any increased risk of lung cancers or head and neck cancers associated with smoking. I found that very hard to believe, knowing there are 70-some toxic agents in marijuana and how people inhaled them. However, they did find some limited evidence suggesting that chronic or frequent users may have higher rates of a certain type of testicular cancer, and that would be males, of course. Connections to heart conditions were less clear. There's not enough evidence to support or refute the idea that it might increase the risk of a heart attack. There was some limited evidence that it can trigger a heart attack, and there was substantial evidence that regular marijuana smokers are more likely to experience chronic bronchitis, and that smoking was likely to improve those conditions. That's not enough evidence to say that it does or doesn't have the risk for respiratory conditions like asthma. There was limited evidence that smoking marijuana could have anti-inflammatory effects, as people seem to think it is. It works on the pain center of the brain, not as an anti-inflammatory. So anybody that says it's taking care of your bursitis or whatever it is, it's not because it's an anti-inflammatory. And there is a link between prenatal cannabis, when a pregnant woman uses marijuana, and lower birth weight of the child. There was limited evidence that you could increase pregnancy complications and increase the risk that a baby would have to spend time in a neonatal intensive care unit. This is the one that bothers me, and I've seen evidence of this. In the terms of mental health, substantial evidence and substantial quantity shows an increased risk of developing schizophrenia in the first place among frequent users, something that studies have shown in particular concern for people at risk. There was also moderate evidence that cannabis is used connected to a small increase for depression and an increased risk for social anxiety disorder. Limited evidence showed a connection between cannabis use and impaired academic achievement, something that's been shown to be especially true for people who began smoking regularly during adolescence, which also has been shown to increase the risk for problematic use, meaning they will continue to use marijuana if they start at an early age. One of the most interesting and perhaps most important conclusions is that far more research is needed. Importantly, in most cases, saying cannabis was connected to an increased risk doesn't necessarily mean that marijuana caused that risk, because it's hard to conduct research on marijuana now. The people that are smoking marijuana are also doing other drugs. The regulatory barriers, because it is a Schedule I classification by the DEA, and excuse me, researchers can't often access the same sorts of marijuana that people use. You got to remember, 40 years ago, the marijuana, people were smoking stems and some buds, and it was like less than a 10% THC level. Now it's up to 95%. It's important to know what works and doesn't work and needs to be more studied. We're not really good at doing this because we can't isolate the individual enough. The fact that so many people use it, of last fall, 57% of all adults in the United States, they thought marijuana should be legal. Only 37% had the opposing view. After the November's election, 20% of Americans live in a state that voted to legalize recreational use, but there's still a whole lot that we don't know. So my obligation as a healthcare professional is to keep you aware of what's happening. My obligation as a healthcare professional also is to keep it out of the hands of people that have no business talking to somebody who has complicated disease states and is adding that to their regimen. Now, if you have cancer and you're in pain and you're going through radiation and chemo, to me, you're a candidate. If you have MS and you're having spasms and it's effective in spasms, you are a candidate. That doesn't mean I think it should be dispensed by anybody other than a pharmacy. I don't. But the law is what the law is. If I got involved right now in trying to dispense marijuana, I would lose my pharmacy license. But some guy off the street or somebody in a cannabis collective legally can grow and dispense and follow the regulations, and it's up to you. Whether or not there's enough checks and balances on it to know exactly what you're getting, I don't know. We have medications now that are being dispensed on the street for pain that people are dying of because it's laced. Just 2 days ago, what the people thought was Percodan was probably Percodan and fentanyl, and they're dying. So, people that are taking Narcan that are getting it from the people that run the clinics. So, and I'm not causing blame. I'm just telling you that this world has gotten crazy about allowing not only chemicals like marijuana, but things like PCP and every other kind of drug, bath salts and all of those kind of things to be entered in. So if you are a drug addict, and we now give you Narcan if you're a drug addict, so you can reverse the effects of overdose, and we can sell you syringes without an ID to make it more available for you. And it's kind of shocking to me as being an older healthcare professional that our reality of our country is to that state. Well, we still have diseases to talk about, and one of those is heart disease. And a lot of people have silent heart attacks, and you don't know, maybe you feel it, maybe you don't, but it's a shocking reality for millions of people across the country. They go for a routine physical, you go in to see your doctor, you find out you had a heart attack that happened days, weeks, or months earlier. About half of the heart attacks that people have are silent, and the symptoms are so subtle that you don't even know that you had it. A silent heart attack is identical to a normal heart attack in all other respects. As critical care cardiologists say, they're actually scarier because when people have symptoms, they know to seek care right away. If you don't have any symptoms, you have no idea that it happened. The danger of a heart attack is that it's discovered after the fact by a routine EKG, and this what prompted me on this article is that I haven't had a physical in 5 years. I'm going to have a physical and have an EKG. But if it could be too late for doctors to repair the damage to the heart, and according to one of the studies in the Circulation magazine, having one tripled the chances of dying from heart disease later in life. It also increased the risk of premature death from any cause. So, as you start to age, you start to set yourself up for what could be a number of things, and you could get very, very paranoid about where you are in life if you're not educated. So doctors say just figuring out you had a silent heart attack is a positive mode because you can discuss with your cardiologist, if you have one, what just happened. What do you do if you've had a silent heart attack? You start thinking about the risk factors and how to manage them in order to having a second heart attack. And since those who have had one heart attack are at increased risk for another, risk factors ought to be aware of all of these, which we've talked about many times: smoking, being overweight, high cholesterol, high blood pressure, family history of heart disease. The most important thing you can do is know yourself and know your risk factors. So never let a symptom get old. If something is different, let your doctor know. If you used to be able to go up and down stairs and now you can't, let your doctor know. If you have shortness of breath or chest pain, let your doctor know. We've said many times on this show, you have to be the person that takes care of your health care. As more and more physicians are retiring, the chances of you seeing a regular family care practitioner is becoming more and more remote. So then you have to be the one to educate them. And as I've told many people, when you go into the doctor's office, write everything down, because they're going to be in a hurry. They're going to want to look at why you came in. You're going to tell them about some other things, and they may ask you to come back for another appointment, depending how busy they are. But it's important that you do that. How do you know if you had one? Well, there's a heart attack happens when there's an artery to the heart that's blocked, and often by a clot. And those blood cells are what carries oxygen, and it can't pass through to supply the heart. Sometimes that causes pain and pressure in the chest, because we explained a couple weeks ago where that blood backs up into the chest cavity, producing a typical heart attack with classic symptoms, but sometimes they're more unexpected, such as a pain in the jaw, the arms, neck, teeth, or abdomen. Another common symptom is fatigue, extreme fatigue in women. Most of us have had one or all of these things. Many people don't know how to look for those lesser symptoms, and they may attribute them to just a passing annoyance or something to mention the next time they're in the doctor, and then they get to the doctor and they forget to ask that. You might have symptoms like fatigue or mild shortness of breath, and your doctor may say you're just getting old, but you need to insist on having an EKG. People with diabetes may not feel any symptoms at all because they have nerve damage and they aren't sensitive to it. So one of the things that I talk about with healthcare is that it changes all the time. And I don't even have the information, but this morning I was looking on the internet, I think it was the New York Times, and there was an article about not drinking water at night. And I'm thinking, I work all day. I try to drink water during the day. But when I get home, I probably drink 3 or 4 16-ounce things of water in one of these hydro flasks, and it's always full. And one of the medications that I take for muscle relaxants cause me to have a dry mouth. So I keep a 40-ounce hydro flask right by my bed, and I drink a lot of water during the night. And I was curious on why they tell you to drink so much water, and then they didn't want you to drink it at night. And I guessed probably what it was from, but I didn't realize the result they'd come to. And they promptly got to that point and said, it has to do with how many times a night you get up to urinate. And the more times you get up to urinate more frequently, the less effective your sleep is. Well, I don't get up at all during the night. Urination is a frequent thing during the daytime, but at night I never get up, and which is probably pretty strange, because I've talked to most people that this is a factor. I never thought about it affecting the quality of sleep, but they even take that farther and say people that only get 4 to 6 hours of sleep generally are at more risk for developing other things from the failure to go into REM sleep and sleep as long as other people. So as we've talked about many things today that were okay at one time and aren't okay in another time, you can see that how confusing. I remember 2 or 3 weeks ago I did a radio show with and I told you a million things, and I felt so frustrated when I left. I said, how is anybody going to remember any of this, because there's so many things going on in healthcare that just keep changing, and we'll have to do our best to remember that. Now, this next thing for the next couple minutes is about Lyme's disease, and we all know what Lyme's disease is. It comes from a deer tick, and it has a bullhead type rash that occurs, and if you take a tick off, make sure you save it and take it into a healthcare professional or take it into the Farm Bureau or the health department and find out if it's a deer tick. And once you find that out, you go into an antibiotic, and you very inexpensively, and you're cured in a matter of a week or 2 weeks. That doesn't mean the spirochete doesn't stay in your system, but the disease can no longer advance itself. But there are 2 new cases of a dangerous and potentially fatal tick-borne illness, and this is in Maine, and that's why I say you don't have to remember this. But Maine is on high alert because there's a brace for a high population tick season because of the winter. And it differs from Lyme's disease as it can be transferred from tick to human in a matter of minutes. And where Lyme's disease is a bacteria, this is a virus. And if you catch Lyme early, antibiotics eradicate it, but with the virus, you don't have options to do almost anything about it. So it's called Powassan, and it's more severe than Lyme disease, can quickly reach a patient's brain, leaving them susceptible to long-term neurological damage. The patients in Maine began presenting symptoms in late April and were hospitalized with encephalitis. They've since been discharged and are continuing to recover, but not all people have symptoms and will not be impacted by the infection, but those who are will have a serious fever, a headache, vomiting, weakness, confusion, seizures, and memory loss. And in 10 to 15% of those cases, they become fatal. So people who are most likely to be symptomatic are those who are immunosuppressed, meaning their immune system is not high, where they could have HIV or some other disease, or those who've previously contacted illnesses like Westphal, dengue, or Lyme's disease. So in terms of young people getting it, it's pretty low. 7 cases are reported annually by the CDC. I'm not doing this to scare you. I'm just telling you that according to a lot of scientific things, these things begin to morph, and in most cases they can become more difficult to treat than they were before. They're mutating, and it's becoming a scary world out there. So in Maine, they're asking for hikers and others who choose to head outdoors to be vigilant and cover themselves up and use a tick repellent with DEET, and wear long pants, tuck jeans in pants, and conduct a tick check every time you're out. So again, I want to remind you that we're under new management at the Bruno store, and be more than happy to continue doing what we're doing, including deliver your prescriptions. Be aware if you're having a new baby in your family, your child or grandchild, and you're going to see a new baby and you haven't got a pertussis shot, you need to get one. Babies have no immunity to this, and you need to be immunized to prevent you from getting it. So I just talked to some people yesterday who are going to have a new baby in October. I failed to remind them that they need to get a pertussis shot for whooping cough, but anybody that has a new child coming into your system, the mother usually has it as a dominant thing, but the rest of the family doesn't. I'd like to remind you we're North Lake Medical Pharmacies with 2 pharmacies for you at 5136 Hill Road East across from Center Lakeside Hospital. Call us there at 263-6192. And outside the Bruno Shop Mart at 347 Lakeport Boulevard, call us there at 263-1328. Thank you, Paul.
Thanks, Bill, and we'll see everybody back here again next Wednesday at 10 a.m. for Health Talk right here on AM 1270 and 96.5 FM KXBX Lakeport.